Hi, I'm Rich Seckle. I'm director of Kentucky Equal Justice Center. We're a civil legal aid organization and proud members of Kentucky Voices for Health. I'm Emily Beauregard for today. We're giving her a break as master of ceremonies of these press conferences. The proposed changes to Medicaid by Governor Bevin and his staff will impact the health and economic well-being of hardworking, low-income Kentuckians, families, and our most vulnerable citizens across the Commonwealth. Today, the campaign Keep Kentucky Covered brings together Medicaid recipients, health advocates, faith leaders, and providers to speak about the impact these changes will have for themselves, their families, and their communities. Our first speaker represents a number of farmers in his role as executive director of the Community Farm Alliance. This is a difficult time for farmers to leave their work, but Bree Pearsall of Rootbound Farm in Oldham County requested her written comments be made available to the press. They're available on the table over there. And Mr. Richards is going to read her comments. Come on, Martin.
Thank you all. Yes, Bree just sent me an email yesterday and was like, Martin, can you please do this for me? It is such a hard time to leave the farm right now. And I relate as a recovering farmer myself. And in a risky business, right? I mean, every day on the farm, there could be an accident, right? Any day on the farm. And knowing that you have that covered is extremely important. And if you want to raise a family and you want to be a family farmer, health insurance is part of your risk management, right? In a risky business. Anyway, I will just go ahead and read what Bree has asked me to read. My family runs a vegetable and meat farming business. My husband and I typically work 50 plus hours every week. Our days begin at 6 a.m. and often we work past sunset. We employ 7 seasonal employees and provide hundreds of Kentucky families with healthy fruits, vegetables, and meat on a weekly basis. As entrepreneurs, we do not have access to employee-sponsored health care coverage. The Affordable Care Act and Kentucky Connect provided us with an affordable path to health care coverage for our full family, which now includes 2 young kids. We originally obtained a private plan through Kentucky Connect and have obtained coverage through Medicaid for almost a year now. The work requirements of the new proposal feel like a slap in the face to hardworking families like ours. The governor says we must have skin in the game and thus create a network of hoops to jump through. Just like the governor, I wake up every morning and work hard to make good choices about my family's health. I want to be able to feel good, to feel free of pain, and to live a long, prosperous life. I want my daughter to grow and be healthy, to eat well and have resources that she needs to thrive. This is my skin in the game. To assume that because I am low income that I have an inferior investment in my family's health is an insult. We are fortunate enough to be able to pay monthly premiums, and paying a premium will not be a hardship on us. But I fear that the premium requirement, among other work requirements, would create another set of hoops for people to jump through and result in the most vulnerable citizens losing their coverage. This is not how we become more healthy as a state. When people lose coverage, their health suffers. I would like to see the governor act with compassion instead of creating a culture of shame for families that receive health care coverage through Medicaid. Sincerely, Bree Pearsall of Rootbound Farm. Thanks.
Our next speaker is Father Dan Knoll from Lexington.
The Catholic Church that I represent today teaches that health care is not a privilege, it's a right. It's an essential requirement to protect the life and dignity of every person. All people, regardless of their circumstances, should have access to comprehensive, quality, and affordable health care. It should not depend on where they were born, what their stage of life, where they work, where their parents work, how much they earn, or where they live. Health care is a human right. Period. The Catholic community in Kentucky serves the sick and uninsured in our emergency rooms, homeless shelters, and on the doorsteps of our parish churches. In our hospitals, we see patients whose sicknesses frequently have advanced critically because they lack preventative medical attention. Having no health insurance or inadequate basic health coverage means premature death. Kentucky cannot sacrifice people because they are poor. We Catholics bring both strong convictions and practical experience to the challenge of health care. Many more lower-income individuals and families in Kentucky will lack the resources to meet the financial burdens of their health care under Governor Bevan's health care plan. For these families, an increase of premiums, cost-sharing charges, and a lockout period will be significant barriers to obtaining coverage or seeing a doctor, much less a dentist or eye doctor. Every proposed state budget reveals the values of the administration. Disregard of the vulnerable indicates its moral index of the common good. A genuine reform of health care in Kentucky should result in health care that is accessible and affordable for all, and not place more restrictions on accessing it. Health insurance options must protect the lowest income enrollees from onerous cost sharing, not increase their burden. The complexity of the proposed plan will discourage access to care. Simplify access. Ensure a human right. And so we invite all Kentuckians to join us in rejecting the proposed changes and work for health care that will promote and defend human dignity from the moment of conception until natural death, attend to the whole person, body, mind, and spirit, while pursuing a general pluralism that respects freedom of religion and conscience, care for poor and vulnerable persons, regardless of race, ethnicity, economic, or social, or legal status, and practice a careful stewardship of resources by restraining costs and applying them equitably across the spectrum of those who must pay for health care. Healthcare policy must protect human life and dignity, not threaten them, especially for the most voiceless and vulnerable. Governor Bevan's proposal is not good healthcare policy. We oppose it wholeheartedly, and we want to work together in promoting the common good.